blasphemous. So this one, because the old model and the new model has the same, so we would want to keep it to what it's belonged. So what we say, all right, yeah, this one will be for the extra security questions. So I'm not going to tell you.
Secrets don't make friends.
Pardon?
Secrets don't make friends.
We won't tell anybody.
Because we'll just keep the secret too.
Yeah, see?
We're just making the secret known by a couple more people.
These are the sacral plexus, right? These are the sacral plexus. We have S1, S2, S3, S4, and S5. What is this? What is this bone?
Pubis?
Sacral
Yeah.
promontory, right? Sacral promontory. And that means it's the L5, L4, L2. So that means about there, just one lobar vertebra about there and go down to this one. Then we have the root, right? We have the root L2, L3, and L4. That root L2, L3, and L4 will form two nerves. One nerve is this one. Okay? That one formed from the L2, L3, L4. And that nerve is known as the femoral nerve. Right? And it passes under the inguinal ligament and it goes down to the anterior thigh and it supplies the 3 or 4 main muscles of the anterior thigh that's known as the quadriceps femoris. And those consist of the rectus femoris and the vastus. We have 3 portions of the vastus: vastus, lateralis, medialis, and intermedius. Right? But if that nerve is damaged, then these muscles will be paralyzed. Then you cannot extend the leg across the knee joint. Right? You cannot extend the leg across the knee joint. You could extend the leg across the knee joint, but you have this muscle will have you do that. So, but if it's paralyzed, you cannot. And we do the reflex. The reason that we do the reflex, this is a patellar ligament. But because this is an overlay from the quadriceps tendon, so it affects. If we strike the knee in this area, we will strike the muscle fiber of the quadriceps. So the reflex is going to protect the overstretch of this muscle. It will extend the leg. That's the reason why. So we do the testing of the knee jerk reflex. What root do we test? We test for L2, L3, and L4. And we could ask in that way. And we could give you the picture of the patellar reflex, and we could ask what root are you going to test them. And then that's the L2, L3, and L4. We will give you a group of a root if it needs all the whole roots to perform work. And this one is part of the L4. You see this is the L4 and the S1, right? This is the S1, and above there is the L4 it's coming down. It forms this nerve that's known as the obturator nerve. The obturator nerve will exit the pelvic cavity through the obturator foramen, and then it goes down to supply all the muscle on the medial thigh. Okay? Supply all the muscle on the medial thigh. So if this nerve is damaged, and that's the way you test. You put the hand, the dorsum of your hand, against the thigh, and push it out, and ask them to resist it, to push it out, right? Which we ask not to do in the life. If the individual cannot resist it, it's just like you push it out, and then this nerve is damaged. So you lost the abduction of the thigh. So it's not, these two nerves not going to go down below the knee. It's just anterior thigh and the medial thigh taken care by those two nerves. And the muscle here is not contributed from the sacral, lumbosacral plexus. Right? It has a straight sacral spinal nerve. It's not come from the plexus. It comes from the straight fiber of the sacral nerve, spinal nerve. And then when it comes to the posterior aspect, you see this is sacral plexus is formed, and then it gives off one nerve, and that one nerve will merge in between the piriformis muscle and superior gemellus. And this nerve, it has two portions. The lateral half of this nerve is the common peroneal nerve or common fibular nerve. The medial half of that nerve is a tibial nerve. All together, it stays in one sheet that call it sciatic nerves. Right? All those call it sciatic nerves. And the sciatic nerves are going to supply all of these three muscles. What are these three muscles called?
The membrane.
Hamstring, right?
Yeah.
The hamstring. And what are those in the hamstring?
The semitendinosus, semimembranosus.
Semimembranosus, and biceps femoris. Right? Biceps femoris. So the sciatic nerve will supply all of those muscles. And then when it goes to the inferior portion of the posterior thigh, it's split. Now it physically split to form, this one is the common fibular nerve, and this one is the tibial nerve. And the tibial nerve going to descend directly, but on its course, it does give the branch to the superficial muscle. What are these muscles?
The
We have
gastrocnemius.
gastrocnemius, we have the soleus,
Soleus.
we have the
The plantar.
plantaris. Right? So we have all of those. These are supplied by the tibial nerve. And then the deeper muscle, we have the popliteus. Right? Then we have the flexor digitorum longus, flexor hallucis longus, tibialis posterior. Okay. Review yourself. And if the nerve, tibial nerve, pass inferior to the medial malleolus, and it's going to supply all the muscle in the foot. Right? In order for you to stand on the tip of your toe, you need this muscle to pull, right? But if this muscle is paralyzed, then you cannot stand on the tip of your toe. You cannot, because this muscle is paralyzed. So that's why we call it the symptom produced by damage to the tibia. You cannot stand on the tip of your toe. And also, this muscle is stay on the medial more. So it will stay on the medial more. It will pull the feet into this way also. Right? When these contract, so you will stand on the lateral side of your foot. So that means you do the inversion of the foot. But if this damage, so you cannot stand on the tip of your toe, you cannot stand on the lateral side of your toe, or you lost the ability to do the inversion of your foot. Now, the common fibular nerve will go down to the head of the fibular bone, and it will swing around, and will go to supply the muscle on the lateral side and on the anterior side of the leg. When it comes into this area, it gives out two branches. One is a superficial and one is deep. This is a deep branch, and this is a superficial branch. This is a superficial branch. of the fibula. The superficial branch will supply 3 muscles on the lateral side of the leg. Excuse me. What is this bone on the lateral side of the leg? The fibular bone, right? And what are these muscles? Fibularis longus, fibularis brevis, fibularis tertius. Okay? But if the superficial branch of the fibular nerve is damaged, so these 3 muscles is paralyzed. And in order to do the eversion, of the foot, you need this muscle to pull on the lateral side of the foot. But if this muscle paralyzed, so you lost the ability to do the eversion. Right? You lost the ability to do the eversion. And if the deep branch of the fibular nerve is damaged, what is this muscle? Tibialis anterior. Right? Tibialis anterior. What's the tibialis anterior do? And we do have these muscles. This is the flexor digitorum longus. Right? Tibialis anterior, flexor digitorum longus. So what these muscles will have you do would dorsiflex. But if it's paralyzed, you cannot dorsiflex. Right? You cannot dorsiflex, you cannot do the eversion. So you lost those. Both brains is paralyzed. Deep brain, you will lose dorsiflex. Superficial brain, you will lose the eversion. So if this combined, if you damage into here, you damage into these 2 brains, and then your foot will assume this way. So what you call this way is a foot drop. Right? It will cause a foot drop. But if I could tag on this one and say if it damage to this structure, what symptom do you see distally to that lesion? That is a foot drop. If I choose the superficial fibular nerve and I say, well, if it damaged to this structure, what symptom is produced distal to that damaged area? Eversion. You cannot do the eversion. If I choose the deep branch, I say if it's damaged to that, what function will you lose? Dorsal flexion. Superficial cannot do the eversion. Deep cannot do the dorsal flexion. Common produce a foot drop.
Okay. Thank you.